I'm Dr. Malik. Today we'll talk about an important topic, blood in gastrointestinal tract. That is bleeding from your intestinal tract, from your stomach or from your intestines, bleeding from your stomach or esophagus, from your esophagus, anywhere bleeding from mouth to anus, anywhere bleeding from anus. Today morning at 4 o'clock, we had a patient of 42-year-old male who came to us with severe vomitings, with blood, vomitings which had frank blood in it, and he was passing motion for the last 2 days in black color. His passing motion in black colored motions for the last 2 days, and he came to our hospital in the morning at 4 o'clock. When he collapsed, he suddenly collapsed and he was brought to the hospital. There was no recordable BP, pulse was very feeble. Immediately we kept him in ICU. We started ventilating him. We kept him on ventilator. He was collapsing. Immediately we started giving blood to him. Blood, FFP, fresh frozen plasma to control the bleeding, and blood for exchange, because already he lost so much of blood. We started giving packed blood cells, PRBC we call it. That is, we started giving him blood and we started giving him fresh frozen plasma, which is taken from blood from others. In the blood bank, fresh frozen plasma is available as an yellow liquid, 100 ml sachets, which is nothing but plasma from various donors, and packed red blood cells, also called PRBC. Whole blood is different from packed red blood cells. Whole blood means you take from the donor total blood and transfuse to others. But PRBC, packed red blood cells, means you are taking only RBCs, you are taking only red blood cells, RBCs, which are there in the blood, from the blood which is given by donors, and you are separating fresh frozen plasma. That means you are separating the plasma separately. You have taken blood, you have separated into plasma and red blood cells, and you are separating both and you are keeping it ready for others. So this is called fresh frozen plasma for control of bleeding, because bleeding factors are used up. All the clotting factors are used up. You need fresh frozen plasma to control the bleeding, because he's bleeding a lot, he's vomiting blood, and at the same time he's passing motion in the stools. That means some amount of blood is going down and some amount of blood is coming up. So in this situation, we kept him on ventilator immediately because he was almost collapsing, and we started giving him red blood cells, that is packed red blood cells, that is almost blood, and we are giving fresh frozen plasma to control the bleeding. This is going both the sides, and to maintain the BP, we had to start him on inotropes, that is some noradrenaline injections to maintain the BP. Okay, this is going on. What exactly happened to the patient? This patient is a known alcoholic. He was on alcohol he was regularly an alcohol consuming personality for the last 10-15 years. He landed in cirrhosis of liver. The liver totally got damaged. Because of alcohol, the liver totally got damaged. So what the condition with which he came to the hospital is called hematemesis. Hematemesis means vomiting in the blood. See, sometimes fresh blood may not come out. See, suppose the patient has blood in he's bleeding from the intestine or stomach. It gets mixed with hydrochloric acid, and coffee colored vomiting cannot come out. Come out if it is bleeding in the intestine and stomach. Suppose the patient is bleeding from the esophagus. If the patient is bleeding, the color of the blood will be frank red, just frank blood, because it doesn't get mixed with hydrochloric acid. He was having frank blood. He was having frank blood in vomiting. So whatever vomiting coming from the mouth, it is called, the vomiting coming from the mouth is called hematemesis. And melena is the term used for black motions. Melena is the term used for black motion, black tarry motion we call it. It gets stick to the lavatory basin, difficult to flush. This is blood in the motion. See, usually if there is a bleeding in the intestines, what happens is, because of the digestion process and all the enzymes, hydrochloric acid, all make it black. The color comes black. It is not fresh red. Fresh red blood will be seen in piles, anal fissure, like that. Piles are anal fissure where at the end of the anus you have piles. So there will be fresh blood if there is piles or etc. But if it is bleeding in the intestines, then definitely the motion will have black color because of, that is called melena. That is called melena because it gets mixed up with so many enzymes and all, it undergoes color changes to black. So that is called melena. Black tarry motion is called melena. There is one more term called hemoptysis. This is hematemesis is vomiting, blood vomiting, whereas hemoptysis means if the patient coughs out, if there is a blood, when there is blood in the sputum, that is the patient is coughing out, then there is little blood with the sputum, it is called hemoptysis. Here this condition, this occurs in tuberculosis, lung cancers and lung infections, etc. But here it is not applicable. Hematemesis is there, melena is there to the patient. Okay. Here later when the patient is stable, we call the gastroenterologist. He has done an endoscopy. Then he has seen esophageal varices. What is this esophageal varices? That is dilated veins in the esophagus. You have seen varicose veins which are dilated in the lower leg of rickshaw pullers, etc. Varicose veins, big veins, and some pregnant females and normal males also. Some people standing jobs and all, conductors, doctors, etc. They will have varicose veins. That is tortuous engorged veins over the lower leg. So such veins are there in the esophagus. This is esophagus. You can see dilated veins here. Why? See, this patient was bleeding from this particular esophageal varicose veins. That means esophageal varices. How? It's bleeding from here. So immediately the gastroenterologist who went with the scope inside has banded a particular vein. That particular vein was banded and he has given some injection, adrenaline around, so they have stopped the bleeding. They have stopped the bleeding and we have recovered the patient. Luckily we have recovered the patient. So how come this varices have come? How come this esophageal varices? What is the cause? The cause is nothing but cirrhosis of liver because of alcohol. See, actually the procedure is called banding and or injection for the esophageal varices, which gastroenterologists have done. See, cirrhosis of liver or non-cirrhosis of liver damage, cirrhosis. Cirrhosis means it is something like, liver is usually a soft organ like a fresh sponge, whereas after damage, complete damage of liver, it becomes very hard, like a used up sponge, very much used up sponge, it becomes very hard. Liver also becomes, sponge will be bigger. After using for 1 or 2 months, it becomes shrunk and it becomes hard. Just like this, the liver also undergoes cirrhosis, it becomes hard, full of fibrous tissue. It is not working, the liver is not working. That's the worst thing anybody can, the only treatment for this is liver transplantation, okay. You have heard it. So liver is totally damaged because of alcohol. There are other conditions where liver is damaged. See, alcohol damages liver, causes cirrhosis. What is non-alcoholic cirrhosis? Sometimes some patients come with non-alcoholic cirrhosis. Mainly it is because of hepatitis, viruses, 5 viruses: hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. So hepatitis A, usually it comes in younger children, and it is usually contaminated water or contaminated food is the reason. Hepatitis E, the same thing is found in adults. Hepatitis E, that is also because of contaminated food and all. These two can be controlled. These two are self-limiting diseases, whereas hepatitis B and hepatitis C are little serious problems. They come with sexual transmission or blood transfusion, some secretions. If you have secretions from others who has already got it, one to other, it gets transmitted from one person to the other through sexual contact. Hepatitis B, hepatitis C. Hepatitis D is a rare thing, forget about it. So hepatitis B is very important, hepatitis C is very important. There is vaccination for hepatitis B, but there is no vaccination to hepatitis C. But treatment is there. Once we get hepatitis B or hepatitis C, treatment is there for both. So this is very important. So these are the things, these 5 things also can cause cirrhosis of liver, because they are caused by viruses, that's called hepatitis. They also can cause non-alcoholic cirrhosis. It need not be definitely alcohol. Without alcohol also, some females also come to us with cirrhosis. They are not alcoholics. They have these infections: hepatitis A, hepatitis E, hepatitis B, C, D, like that. Okay. So hepatitis B and hepatitis C are very, very important. You know them. Hepatitis B has got vaccination. From childhood they are giving vaccination to prevent hepatitis B, whereas in hepatitis C, it doesn't have any vaccination, but there is treatment now available for both hepatitis B and hepatitis C. They are from human to human, like AIDS virus. This virus also comes from human to human through blood transfusions or sexual intercourse or anything like that. Okay, so please be careful. So what happened in this particular case is, the patient was alcoholic, the liver totally got damaged, cirrhosis. Actually, there is one more situation. The actual problem comes now. See, generally you know what is hypertension. That means the tension in the blood vessels. The blood vessels become tough. And pumping becomes difficult. This is called hypertension. There is one more hypertension in the body called portal hypertension. It can be childhood portal hypertension, or it can be acquired. Acquired means you got it later. From childhood it can be there, or you got it later. What exactly is portal hypertension? I will tell you. This is liver, this is gallbladder, here will be pancreas, and see, there will be blood circulation. Inside the liver, gallbladder, pancreas, etc., oesophagus. So this particular area, it's called portal tree, portal biliary system. We call it biliary system because it produces bile. Liver produces bile, 1.5 kgs organ. So it produces bile. The name is called, this particular area, the liver, the gallbladder, the common bile duct, the pancreas, all the juices get emptied into the intestine, small intestine, for digesting food, for digesting. This is called common bile duct. Okay, so this particular system is called biliary tree or biliary system. So if this system gets damaged, if liver gets damaged, so there is blood circulation inside. In this biliary system there is blood circulation. If this particular blood circulation is affected because of liver damage, all the veins are tensed up. I mean, there is backflow. I mean, the blood flow is not proper, so there is reverse flow. So like esophageal varices, all the veins become dilated, tortuous, big. Anytime they can rupture. This is called, there is tension, there is hypertension in the biliary tree, there is hypertension in the biliary circulation. This is called portal hypertension. So only limited to this particular part, liver, gallbladder, pancreas, esophagus, etc. Only limited to that particular head because of the severe pressure inside. All the veins are tortuous, big, etc. This is called portal. Because of this portal hypertension, this patient had esophageal varices which have bled. One of the blood vessels in the esophageal, which is one of the veins, which is so big, it has started bleeding. Any reason, it can just burst and started bleeding. So we had to control it through banding. See, we have saved his life temporarily, but what next is he has to undergo liver transplantation so that he can be normal for some time, some years. So this is what happens. See, this is a life-saving situation. This is a life-threatening situation. I'm sorry, a life-threatening situation. We have done what we could do, but we cannot completely reverse this process. We cannot completely reverse this process. Other conditions where there will be bleeding inside the stomach or inside the intestine is because of ulcers. Then ulcers can be there inside the stomach, inside the intestines. They can bleed, they can have bleeding. Blood disorders, some blood dyscrasias, where there is the bleeding disorders are there. The blood is not properly clotting, and you are taking some aspirin and other tablets for your blood thinners you are taking, that also can cause gastrointestinal bleeding. And in paralytic patients, some paralysis patients also, chronically bedridden people will have this problem. Sometimes suddenly there will be bleeding inside the abdomen or inside the intestines, inside the stomach or inside the intestines. This can happen, but it is not that dangerous. It will be slow. But this is a rapid, what the patient who has come to us is a rapid deterioration. But others like this, ulcers, blood disorders, they are slow. They give you time. So this is what happened in that particular case. So the care you should take is avoid alcohol. Check yourself, check your blood for hepatitis B, hepatitis C. Hepatitis B and hepatitis C, you must get blood check. And if it is negative, it is better take hepatitis B vaccination. Hepatitis B vaccination you must take. These are some of the precautions you are supposed to. Hepatitis B vaccination, everybody should take because hepatitis C vaccine is not available till now. Hepatitis B vaccine is not available not till now. In childhood, now in pediatric schedule, when the child is born, they are already giving hepatitis B vaccine, hepatitis A vaccine, they are giving all vaccines. So children are safe nowadays. In our childhood, they were not given. Children are nowadays safe. To some extent, we have to strictly avoid alcohol. There is no cut short methods for it. Even 2 pegs per day is dangerous. Any amount of alcohol definitely damages the liver because the alcohol gets absorbed in the stomach and the food gets absorbed in the intestine. That is the difference. So if you take, some people will have a feeling that I am taking good food with alcohol. No problem. No. Alcohol gets absorbed in the stomach, your food gets absorbed in the intestine. So damage will be there. Alcohol directly goes to the liver. And some people say, I take only 2 pegs per day. No damage will be there. No, wrong. Any amount of alcohol damages the liver. This is a fundamental thing. Please be